Mrs. Horn. How are you doing today? My name is Christopher Tardo. I'm here to insert your NG tube to ensure that you're receiving the proper nutrients since you're having difficulty swallowing and eating right now. Can you confirm your name and date of birth for me, please? Alright, and you don't have any food, environmental, or latex allergies? Okay, perfect. Well, first, the way this procedure is going to work is I'm going to stick this NG tube down your nose and into your esophagus until it reaches your stomach, and your food will be supplied through this tube. First, we're going to measure the tube from your nostril. We'll check which nostril we're going to use. Alright, seems like you're breathing the best out of your right nostril, so we're going to go ahead and use that one. I'm going to measure the tube from your nostril to your earlobe, and then from your earlobe to the tip of your xiphoid process. I'm going to go ahead and mark this with a piece of tape just to ensure that I don't insert the tube too far or not deep enough. And now, before we begin the insertion, we're going to lubricate the tube about 2 to 4 inches. Okay. Now I'm going to insert it slowly into your nose. And now that I've reached your pharynx, we're going to go ahead and tip your head forward a little bit and continue the insertion. And if you need to drink any water during the process, you can. And I'll just continue to insert with each sip that you take. And if the patient were to experience any distress or gasping, coughing, I would stop inserting the tube and I would pull it back into the nasal cavity. However, Ms. Horn is not experiencing any distress or complications due to the insertion, so we're going to go ahead and proceed with the process. And there we are, the tube is fully inserted. Now I'm going to go ahead and tape the tube to her nose to make sure that the tube does not become displaced or move around any. There we go. And now, before we start the feeding, we're going to go ahead and wheel Ms. Horn off to radiology and get an x-ray to ensure that the tube is in the correct placement. Alright, Mrs. Horn has come back from radiology. Everything looks good and is in the correct place. So I'm going to go ahead and remove the metal wire from the NG tube, and we can start feeding. We'll return in a couple of days and remove the NG tube from Mrs. Horn. Alright, Ms. Horn, it's time to remove the NG tube. You did great. And to remove it, we're just going to slowly pull the NG tube out. Alright, and then we'll wrap it up in this cloth. And we are good to go.